A new study that just came out shows that inflammation can cause malnutrition, and everybody in the hospital has inflammation.
Yeah.
So we need to be supplementing these people with vitamins and nutrients, right?
Well, if you don't have the building blocks to make what you need to get well or to maintain your body, you're simply not going to have the proteins and all the kinds of things that your body makes to defend us against disease.
And we all know that hospital food leaves a little bit to be desired.
Well, a lot of these people aren't even eating. Okay, they've got
Well, there
NG
you
tubes
go.
down, and it doesn't take long before nutrition becomes a big issue. So the article in the American Journal of Clinical Nutrition this December of 2011 was really a landmark article in a lot of ways, because a lot of us didn't realize that inflammation itself causes the body to lose micronutrients and macronutrients that are very important for maintaining and restoring our health.
So one of the ways that we know that we have inflammation is if we have elevated C-reactive protein levels, or CRP.
Exactly.
So maybe you can talk a little bit about what that is.
Yeah, it's a marker of inflammation. It's just a protein that we measure, that as inflammation gets worse, we find that the C-reactive protein level gets higher. It's much like following a sedimentation rate, which does the same thing, or a fibrinogen level, which does the same thing as well. So these are markers that tell us that things are going on and we need to pay attention to what's happening.
And this test is also done for people that have had a heart attack.
It's done for anybody who
Or
you want to follow.
Maybe we'll have one.
Well, yes, and in the acute setting, usually that's exactly what we do. So what we're looking at is deficiencies that we find in the cells of our body rather than just in the serum. When we do blood tests, we're measuring serum levels of different kinds of important nutrients. And those nutrients go down, and when they are low in the serum, you know that they're really low in the cells, because the cells are the storehouses for a lot of these materials. And if they will give up what they have to maintain levels in the serum that are normal. So when you see a drop in a serum level, you know that there are massive deficiencies at the cellular level. And that's what determines how well we do in terms of having the raw materials we need to build the products we need to get well.
So maybe we can talk a little bit about what some of the vitamins and minerals are that are deficient when you have inflammation.
They only measured a few of them, but you'd have to guess that most of them are big issues. They measured things like vitamin A and B6 and vitamin C and vitamin D and selenium.
And so what's selenium?
It's a mineral that helps us a lot with making our defenses work better.
I saw a movie where somebody was poisoned with selenium.
Too much is lethal, too little is lethal. You've got to have just the right amount so you got that balance. A lot of people take something like 800 micrograms for a day or two of selenium when they have a cold, because it'll tend to turn on the immune system so that it makes more powerful defense mechanisms. Now, one of the things that we don't do in clinical practice, and not even in the hospital, is measure cellular levels of these micronutrients and these macronutrients.
How do we do
You
it?
don't.
Then?
Well, you have to know what to do. There is a test for magnesium that's done only by one laboratory. That's in Foster City.
That's when you scrape the inside of the mouth rather
You
than
take
drawing
the cells.
blood, huh?
You take the cells off the floor of the mouth. You put them on a slide. You send them to Intracellular Diagnostics, which is the lab that does it. And Bert Silver would be happy to receive your samples. And they then shoot an electron beam at it, and it fluoresces, and you can tell how much magnesium you have inside the cells.
But this is very rarely done. They usually do
Hardly-
it with your blood, right?
Yes, but the problem is you can have a normal level of magnesium in your blood and be severely deficient and actually even have a problem from it, like a dangerous cardiac rhythm disturbance or a seizure or some other problem that's life-threatening. So that's a big deal. These other micronutrients, we don't have tests that are done in the hospital or even in clinical practice in the mainstream, but we do have tests in nutritional medicine that are very good. Things like the SpectraCell test, which is done out of Houston, Texas. I went to their lab to see it about 15 years ago because I thought, if this is that good, I want to see it. And it is that good. And what they measure is the level of micronutrients that are in lymphocyte cells. So they'll take your blood, separate out the lymphocytes, and then they'll put the lymphocytes in about 30 different wells, okay, different little culture mediums, and they will then find out how much of the stores there are by using it up by putting certain kinds of microbes in there, and when they run out of nutrients soon, they know that there's not that much there. So they have ways of measuring what's inside of a cell, the lymphocyte in this case, and these tests are critical and should be done on people who are sick in the hospital.
So let's talk a little bit about, maybe we could just cover some things that are conditions that are inflammation, because I think a lot of times people hear the word inflammation and they think, oh, I need to take a non-steroidal anti-inflammatory drug because it's anti-inflammatory.
Well, it will help to reduce some inflammation, no question, but at a price that's far too high.
Well, what about an injury when somebody's inflamed because they sprained their ankle or something? Does that count?
Every illness there is associated with inflammation. So inflammation is common. It's a final common pathway. But it's like working on the wrong end of the disease. You want to just use anti-inflammatory agents because you'd like to fix the problem that caused it. Now, with a sprained ankle, you can't do much. So what you might do there is cast it, rest it, use some infrared light to make it heal faster.
Take some vitamins.
And maybe, well, that kind of tissue depletion isn't going to be much because it's only a sprained ankle. But if somebody's got a heart attack or a stroke, or they have a diverticulitis or some overwhelming infection,
vasculitis or arteritis.
Those things have a lot of problems that need to be looked at from the point of view of micronutrients, and that's what this American Journal of Clinical Nutrition article is trying to say. So yes, inflammation is common. It's why you have to know something to be able to interpret these things. And I have to admit, it's taken me 35, 40 years to begin to appreciate when it's important, when it's not, how to measure for it, what to do with it when you get it, and then to see if you can deal with each person individually. If you have 1,000 patients with hypertension, every single one of those patients is different. It's not a one-size-fits-all treatment. Inflammation is the same way. So we have to know our patients. We have to be with them. They're not just people with diseases. Okay? They're not just the disease that we're treating. We got a human being attached to it. So when we're looking at inflammation, and we need now to be paying more attention to the critical nutrients that sometimes we're losing that could be critical and even be life-threatening.